The reality is that a 6-week ban is a total ban.
You'll hear over and over again is how arbitrary this is and how it's not informed by doctors at all. These laws don't make sense.
Because you happen to have a uterus, you are somehow less worthy of healthcare and less worthy of interventions for your health because you happen to have a uterus in this day and age. That's essentially what's happening in Florida and in this country.
In this episode, brought to you by Planned Parenthood of Southeast and North Florida, we dive into the state of abortion access in Florida and the national public health crisis exacerbated by abortion bans. This is Birds.Bees.Bodies. Welcome to Birds.Bees.Bodies, a Planned Parenthood of Southeast and North Florida podcast where we break barriers, tear down stigmas, and promote open discussions on sexual and reproductive health. Get the buzz on topics from puberty to menopause, contraception to conception. No topic is off limits. So sit back, relax, and let's dive into a judgment-free zone to promote sexual wellness.
All right. Well, welcome everyone to our podcast, Birds.Bees.Bodies, brought to you by Planned Parenthood of Southeast and North Florida. We have been talking about all things sexual reproductive health in our last few podcasts. And I'm your host, Michelle Quesada. I'm the Vice President of Communications. We are very excited and anxious about the conversation we're about to have today, which is about the state of abortion access in Florida right now. And joining me for this podcast, we have Laura Goodhue, who's our Vice President of Public Policy at our organization. And we also have our staff physician, Dr. Shelley Tien. So welcome to you both. Laura, if you want to start off just giving a brief background about yourself and your work here at Planned Parenthood.
Sure. So thanks. I'm so excited we're doing this. This is fun. Listen to podcasts all the time. Now I have another one. So I have been doing advocacy work in Florida, primarily healthcare advocacy for over like 20 years. And I've been with Planned Parenthood for 10 years. So I've seen a lot of things. My role here is to mobilize and get our volunteers and our activists involved in the work that we do, basically defending access and making sure that the doors stay open at Planned Parenthood, which is an interesting topic today. So yeah, I'm constantly, fighting in the legislature, sometimes electoral season, but just really happy to talk about this. Happy to talk about it, but it's sad to talk about it as well and what we're going to be facing in really less than a week.
Absolutely. And Dr. Tien, if you want to give a brief background about yourself as well and your experience here in Florida and other states.
Sure, of course. Yes. So I'm Shelley Tien. I'm an OBGYN by training. I have a subspecialty in maternal fetal medicine. So I take care of patients who have high-risk pregnancies, and I'm also a provider of abortion care. So I've been with Planned Parenthood for 3 years now. So I've provided care to patients in Florida and seen all the changes that have occurred in Florida over the last 3 years. And prior to the Dobbs decision, which is better known as the decision that overturned Roe versus Wade, I provided abortion care in Oklahoma and Alabama. And then I also currently travel to Kansas to provide care. And then I'm part-time with a maternal fetal medicine private practice in Tucson, Arizona.
And I'm glad you mentioned the overturning of Roe v. Wade, which is kind of, what kind of spiraled everything across our country after that took place. One of the things that I wanted us to talk about is how did we get here? How did we get to a 6-week ban in our state?
Yeah, there's a lot. The Florida legislature passed these laws. Okay, so this is a state law. And, we hadn't had that many restrictions for a really long time. Like Florida actually has a number of providers, especially compared to like the surrounding southern states. One of those reasons is because in the state constitution, we have a stronger protections than even the federal constitution. It's called a right to privacy, right? And it said that government shall not interfere in our personal private decisions. And for a long time, that held back like the worst of the laws that the Florida legislature could pass. In fact, they were afraid to pass laws because they knew the courts would overturn them. But then Roe v. Wade fell. And then at the same time that the court makeup changed federally, it also changed in our state. So, then President Donald Trump was able to, appoint people at the federal court that overturned Roe v. Wade. And similarly, the governor in Florida, Ron DeSantis, appointed justices that were very conservative and anti-choice, quite honestly. So then what we saw was the legislature passed a law that banned abortion at 15 weeks, which has been very problematic. And we've been living under that for over a year now. It's been horrific for patients already and traumatizing. And Dr. Tien can just talk about the patients that she's provided care to beyond 15 weeks, before 15 weeks. And then the very next session, even before like the 15-week ban, kind of went into effect or was settled, they passed another law banning abortion at 6 weeks, which is before a person even knows they're pregnant. And so Planned Parenthood and some other providers tried to, file a lawsuit under this privacy clause, but this court was just like, yeah, that doesn't apply to abortion. You're right. Your right to privacy doesn't apply to abortion, which we, vehemently disagree with, but that's also where we're at now. And so the 15-week ban has been in place, but in less than a week on May 1st, the 6-week ban goes into effect, which again is before a person, most people know that they're pregnant, especially if they're not trying to get pregnant. But there are very, very minor exceptions after 6 weeks for the health of the pregnant person, or if there's a fatal anomaly with the pregnancy, which is problematic in and of itself.
Let's talk about that, what 6 weeks means. I mean, 6 week means in 2 weeks after missing your period, you have had to realize that you might be pregnant, take a pregnancy test, make an appointment, make 2 appointments in Florida, because you have to have 2 in-person appointments at least 24 hours apart in order to get abortion care. So all that has to happen before 6 weeks, which is just 14 days after a missed period, if you have a perfect 28-day cycle, right? Which not all people have. Dr. Tien, talk about that. Talk about patients who come to you. Around what time are they realizing they're pregnant or even suspecting it? I know it's different for everybody, but what are you seeing patients are so confused about now with this ban going into effect?
So, the reality is that a 6-week ban is a total ban, right? There's no, I don't think that you can even pretend to make an argument that there's anything flexible about it. So, many women do not have regular cycles for many health-related reasons. And then in addition to that, it requires a recognition of pregnancy detection, and then to be able to make 2 in-person visits to see a physician, for abortion care. And, the reality is that, most patients who seek abortion are already parents. They already have other children. And so when you actually look at the context of people's lives, this is time taken away from work. This is childcare that they may or may not be able to find in time. So the 6 weeks is, there's nothing generous about it. There's nothing thoughtful about it. It is a total ban. And the 6 week is, it's an arbitrary number, right? That was picked. So it's essentially a total ban. It is a total abortion ban.
Yeah. And you mentioned, patients, living their lives, unless you're actively trying to get pregnant, that is very early to even have any signs that you might be pregnant. Just the other day, I was talking to one of our other physicians who mentioned a patient who came in who had a newborn, was breastfeeding, hadn't even gotten a full period yet, and found out they were pregnant. And so there's so many things that can happen in people's lives. And now you're asking them, if this person had come to us after May 1st, they would have to travel with a newborn now across states to be able to get access to care. So talk about that. How many of our patients are actually able to make that trip and travel? Like, how much of the financial liability is this for them? How it kind of just derails the structure of their livelihoods and just putting their health at risk, because they have to travel if they have a condition to get to another state.
Yeah, I would say even now we see very few patients under 6 weeks. So we're talking about Florida, but in today's reproductive health landscape, it's just about impossible to talk about one state without some reflection on the other states, right? That's the reality. And so Florida, and this will not be a surprise to anyone who provides care in Florida, is currently surrounded by, many, many states. Florida, we can currently provide care to 15 weeks, but, for the last year, that has not been the case in many, many states surrounding Florida. So when we talk about Florida, we talk about patients in Florida, but we also talk about all the patients coming from out of state. And pregnancy is very much a time-sensitive issue. And so even now we see very, very few patients who are actually under 6 weeks. So it's just, it's devastating. It's truly just purposeful intent to prevent patients and families from getting the health care that they need.
And I want to talk for a moment about the exceptions in this law, which we know are rarely any exceptions at all for rape, incest, human trafficking. Putting that barrier on survivors of these cases to have to require show proof of documentation, to have to be able to do that up to 15 weeks, right? If they don't do it before 15 weeks and they're not able to take that exception into account. And we also have the exceptions for life-threatening scenarios to the pregnant person or a fatal fetal diagnosis. Laura, you can talk a little bit about those exceptions, how they're written, and how complicated it is to even be able to use those exceptions in these cases.
Yeah, I think just the important thing that you'll hear over and over again is how arbitrary this is and how it's not informed by doctors at all. These laws don't make sense. And then when you dig into them, they make even less sense. So the reality is that people have different opinions on abortion, right? It's a spectrum of how you feel about it. And so the laws are written, with some of this, with the voters in mind, quite frankly, which is, it's all politics, right? Which is very unfortunate. People are not centering the patients. So they're not centering the reality of what a survivor of rape is going through. And that is the honest truth. And they will put, the legislators who are trying to ban abortion will put an exception in for rape or incest because they know that scores them political points, which is disgusting, frankly, right? But the exceptions are basically meaningless. So this law says that between 6 and 15 weeks, if you've been raped or you are a survivor or victim of incest, then you can get an abortion, which is just complicated, right? So beyond 15 weeks, no, but between 6 and 15. And so people have to kind of like figure this maze out. And then if you are a victim of rape, you have to show documentation, right? And we know that the vast majority of people that have gone through this situation, and you have to show that documentation within a timeline, right? So in that aftermath, you are already traumatized. You've just found out you're pregnant by your rapist. Now you have to figure out how to get to an appointment that you're pregnant. So you're dealing with all of this and you have to get the documentation, which could be a court order or, a police record, but a lot of people don't want to report this. And a lot of it is intimate partner sexual violence. And so they probably they could have other issues, especially victims of incest, right? And so the folks that have authored this law, I've talked to them and they're like, well, this is so we know, and so we can expose it and we can punish the person, that was responsible, but you're not thinking of the patient. You're not thinking of the person who now has to give birth to their rapist child, right? And so why are we even making people go through this? And I can tell you, once election season's over, I can see the sponsor of this bill she doesn't even like that there's a rape exception. She'll take it right out. She's even said so on the floor of the Florida House of Representatives.
And then there's the exceptions of those life-threatening scenarios to the pregnant person, which we've seen, Dr. Tian, patients that have been denied or delayed care because of these vague exceptions. It requires 2 physicians to sign off on it. And even physicians at hospitals, and across our state are asking questions, what actually merits a life-threatening scenario to the pregnant person? Can you talk a little bit about that?
Sure. I'm going to just briefly add to what Laura said about the rape and incest exception. So when you actually look at survivors of violence, 75% know their perpetrator. And so the reality is that most survivors of violence, it's not a stranger who assaulted them. It's someone that they know. It's someone within their personal circle, which is why sexual violence is so incredibly underreported. It could be someone that they actually trust. It could be a family member. It could be a friend. And so, in that regard, the rape and incest exceptions they're not realistic. The other thing too is that to report, for these patients who've, just endured a really, really violent experience, and then usually have to go through like an examination. And it's very, very violating. You stand naked on a sheet of paper in the emergency room, and they pretty much from head to toe go through your whole body and do an exam and try to get as much DNA as possible, including checking underneath your fingernails, because that way you can prove that you were fighting back and that it was truly, truly violent. I mean, it's awful. It's awful. So the rape and incest exceptions they're not realistic, and they're not exceptions. There's nothing, generous or inclusive about those exceptions. And then, to talk about the health exceptions, boy, I could talk hours about health exceptions. So, at the end of the day, health exceptions, pregnancy complications, it is a discussion between a patient and her healthcare team. There are many, many, many complicated, maternal health conditions and also fetal conditions that can arise even in a patient that doesn't have, who is otherwise healthy and does not have any pre-existing conditions, that warrant really tailored, complex, and nuanced discussions that should be left between patients and their healthcare team. And so, these exceptions are, terribly inadequate to address, the grays and the complexities of medical care. In addition, these exceptions are really antithetical to how we practice medicine. And so in the care provision of patients as physicians and healthcare providers, it is our responsibility, our duty, the oath we took, that when we recognize a disease process that is starting, we intervene, right? The provision of healthcare is that we intervene when we see a problem developing before patients get too sick, before they get to such a point that they suffer permanent morbidity, disability, harm, death. And so exceptions that mandate that we wait until patients are so sick, and then we're given the legal green light to intervene, are antithetical to the oath that we took as physicians. We've seen this happen in Florida, and this is happening in many, many states across the country. It's despicable. It's disheartening, to think that because you happen to have a uterus, you are somehow less worthy of healthcare and less worthy of interventions for your health because you happen to have a uterus in this day and age. That's essentially what's happening in Florida and in this country.
It's really sad and tragic. And I think a lot of people don't realize, even people who have mixed feelings about abortion care overall, don't realize how these blanket standard laws that cannot be applied to every single case, right, are impacting anyone who can become pregnant, even in those intended pregnancies. At any point, if you've ever been pregnant, at any point you can suffer a complication in pregnancy. Pregnancy is so uncertain. There are so many unknowns. You don't even go through your initial screening for diagnostic testing until 10 to 13 weeks, your initial. And then you don't have a full anatomy scan until 18 to 20 weeks. Mm-hmm. And sometimes, I'm sure Dr. Tien, as a maternal fetal medicine, you're well aware that, you can even talk about this, that there's certain things that can pop up even well after that are not screened for, you can't actually detect.
Yeah, absolutely. The reality is that, you have to establish care with an OB, a family medicine OB provider, to get diagnostic testing that has to be done through maternal fetal medicine. And so there's fewer of us. Anatomy scans are good screens for basic structural concerns, typically performed between 18 to 22 weeks. But there are a variety of fetal conditions that we can't detect at that time that can develop later on. There are structural heart concerns that can develop later on. There are skeletal and bone concerns, many of which are lethal or have long-term negative impacts on someone's life that we may not be able to see until much later in pregnancy. And so that's just the fetal aspect of it. When you look at the maternal aspect, there are many, many, many health conditions that can occur, that sometimes the standard of care is talking about pregnancy termination. And if it's 2 a.m. and your loved one is having a pregnancy complication, you would want your medical team unequivocally focused on providing care for your loved one, for your mother, your sister, your wife, your daughter. You do not want your medical team worried about which lawyers they have to talk to and whether or not they can provide the care that they were trained to provide, because it's not clear with the laws if it's consistent with the exceptions. And so, we've seen as a result fear and delays and also withholding of what should be the standard of care in a variety of circumstances.
Yeah, I don't think we've ever seen doctors having to consult with their ethical boards and their attorneys overnight, over hours, on weekends to decide if they're able to care for a patient or not. If that was you and your family, you would be furious.
Dr. Tien, I've been wondering about the miscarriage. Can you, because we've been hearing about that in the news, can you explain a little bit about how we've heard of people that have miscarried in the emergency room? Like, what is going on there with these laws and people that are just need simple miscarriage management?
So I think it's clearly just fear, right? It's fear and confusion. Um, and it's a very good point, because I think it impacts the patient and the individual healthcare provider, but actually impacts healthcare systems. It impacts healthcare systems. And so, no one should be miscarrying in the bathroom, of the ER, or when they get home. So these are clearly patients that, had a complication, that had care that they needed, and that they were denied care because they presented to a larger healthcare system who did not feel that they could care for this patient out of fear of, litigation, threat, persecution, prosecution, legal ramifications. So it's clearly happening. So there's no reason that this should be occurring. There's no reason. If a patient presents, to a hospital care setting, to a clinic care setting, their healthcare providers, both individually as physicians and nurses, and also from a system perspective as a hospital, they are mandated and they should be able to provide that care, and that's not happening.
And let's talk about this 6-week ban really tying the hands of providers in those cases, because there are cases where someone might be pregnant and they start to show signs of miscarriage. They go to get care at a hospital or a clinic, and there's still cardiac activity. And at that point, your hands are tied. There's nothing you can do but wait it out.
Well, there's nothing you can do except wait it out until they are so sick and at the brink of death, and then you're given the green light to act. It is, I just, as both, a physician who's been doing this for 15 years and in talking with my colleagues in Florida and across the country, it is just violent and despicable what we are putting patients through.
And just to understand the exception, the way that this is going to happen in Florida is because you need 2 physicians to sign off. I mean, there's a lot of other reasons, right? But it's a miscarriage in the middle of the night, whenever, right? And so if it's the only exception, so you're beyond 6 weeks, but to terminate the pregnancy legally, or a doctor could be, held liable, is 2 doctors have to sign off and say the health of the pregnant person, or there's a fatal fetal abnormality. So you have to get 1 doctor to sign off. Then you have to find another, right? And a lot of physicians, and I'm not a physician, but they want to see that, they want that to be, they want to see the patient, because now they could be, liable. And so just getting 2 people to sign off is another place where we're having an issue. And this is an easy fix. I mean, if we could, and I wish that there were more, I'm going to just say this, I wish there were more doctors like Dr. Tien who, who work in hospitals, who get this, that would speak out. And I believe we'll see that as we see more traumatic experiences. But it's just
get to that, though, in order for people to wake up and realize something needs to be done about it.
Unfortunately, yeah.
To shed a little perspective, there is no other area of medicine where there is an arbitrary mandate for 2 physicians to approve and sign off.
It's ridiculous. And I wanted to touch on something that, we talked about those fetal diagnoses that could happen much later in pregnancy, those complications that could arise at any point in pregnancy. The opposition, those who are against abortion, are very adamant about, creating these false narratives, these scare tactic messaging about, well, the reason why we need this is because people are having abortions right up until the time of giving birth, and even after birth. And it's like, this is just ridiculous. This is not happening. And so as a physician, as an expert in this, Dr. Tien, I'd love you to talk about, what are the cases where an abortion later in pregnancy might be needed, and when does this happen? I know these are scenarios where this is so tragic for the family. This is something that's gone terribly wrong in pregnancy. This is not something that someone's waking up at 8 months of pregnancy and saying, oh, I'm going to have an abortion today.
So patients do not go through an entire 40 weeks of pregnancy with all the pregnancy-related health complications of diabetes and high blood pressure and hyperemesis with starvation and weight loss and bleeding. Patients do not go through an entire pregnancy and then wake up on their due date and say, I want an abortion. That is not a reality. That is not a reality. And so absolutely, I think it's really important that we call people on making false narratives and frankly, just overtly spreading misinformation. So patients who make a decision for abortion care later in pregnancy are patients that have highly, highly desired, wanted pregnancies, have invested a lot in their pregnancies, many of whom have already picked out a name for their baby, built their nursery for their baby, maybe even had a baby shower, that receive a diagnosis, a devastating diagnosis. And so, these diagnoses, whether it's, a heart condition that we don't have good interventions for, a skeletal growth problem that we have no interventions for, a major problem with the development of the brain, where the prognosis is extremely poor, and can lead to months of pain, suffering for that newborn before an eventual death. These are devastating discussions to have with these families. And so, when these discussions have to occur, and I've had many of these discussions, this is unfortunately one of the sadder but bread and butter parts of maternal fetal medicine, is that when something devastating does come up, we have to talk to families about it. We give them the information. We talk about our concerns. We talk about, how does this impact the pregnancy itself, where they can deliver, and the care that can be provided or not provided afterwards. And so our role as physicians is to provide families with all the information. And then from that, they make the decision that is best for them. And for some families, they don't want to have a child that is going to suffer for 10 minutes, 2 weeks, 5 months. And for a lot of these families, it's the ultimate, kindness. And so, these are, unusual, and kind of devastating discussions that really just belong within, the healthcare team, the patient, the family, and their healthcare providers. And so, yes, it is very, very important that the public realize that, patients don't go through an entire pregnancy and then just change their mind. That is not a reality. And so these families that actually experience these horrible, awful, these are moments of grief. These are life-altering losses for these families. And so I think it's important that their voices are uplifted and that their truths are told, because that's the reality of who seeks and who needs abortion care later in pregnancy.
We've been talking about this, these bans, and we've seen bans across 21 states now of our country, really creating a public healthcare crisis. We've already seen it nationally, and it's going to only be exacerbated in Florida now this May 1st. there's a public health crisis because of the patient impact, what's happening to people's lives, endangering people's lives. But it's also because physicians are not able to practice in the full scope and the expertise of what their training and what their education have brought them to do this, to do this work. Talk about that, the strain on physicians to be able to make those decisions. We've already seen with the 15-week ban, we had OBGYNs, skilled OBGYNs that left our state because they couldn't practice to the full scope of their ability. And there's a real fear that we'll continue to see a shortage of talented, skilled doctors in our state.
Yeah, absolutely. Absolutely. I think a great example of this is Idaho, right? And Idaho is currently in the news right now because of the discussions around EMTALA and the Supreme Court. But Idaho, as a result of their, complete draconian total ban, and a ban that also had very, very threatening consequences for physicians, about 22% of their OBGYNs have left the state of Idaho. As a physician, number one, you're not going to want to practice in a state where you can't provide the full skills that you were trained to provide. And number two, physicians, they're not going to want to practice in a state or raise their families in an environment where they have to worry every single day. Am I following the law? Is my, my medical decision making consistent with arbitrary legal, legal laws that have not, are not at all informed with how we provide medical care. And so physicians aren't going to want to be in an environment where they can be, imprisoned, fined, lose their license for following their calling. So we've seen that in Idaho, and specifically to maternal fetal medicine. There's been physicians leaving the state. In an article, it's probably not too recent, but probably within the last year, I think there's only 9 MFMs left in the entire state of Idaho. And so absolutely it impacts, we're going to see movement of physicians. And then when you kind of take a step back, we're going to see movement of other healthcare providers. And if you don't have healthcare providers, physicians, nurses available, you can't keep your hospitals open. And if you can't keep your hospitals open, so for example, not all hospitals are birthing hospitals. To be a birthing hospital, you have to, perform enough deliveries every year to have a NICU, and there's different levels of NICU, but to maintain a NICU that can take care of a complicated preterm baby, you have to do enough deliveries, you have to have enough staff. And if you don't maintain that, you're going to have closure of a birthing hospital. So then what's going to happen to all of those communities that can't leave that state? Alabama had closure of 3 birthing hospitals recently. What's going to happen to those patients that don't have the ability, the capability to leave Alabama and go elsewhere? And so we already had pre-existing maternity care deserts, and we're going to see just so much more of that. And the reality is that when you have such inequities in healthcare system provision, you're going to see death. There's going to be maternal death. That's what it comes down to. That's the reality. That's the reality. There's going to be more maternal death.
We're in for a very dark period in Florida. We already had, dark moments since the 15-week ban was put into effect, and now this the most restrictive ban we've ever seen in our state. But there is a silver lining.
Yeah, so Florida has a unique process. I talked about our Constitution before, but for the citizens and the voters of Florida to directly change their Constitution by petitioning the government. And so throughout our history, we've actually been able to pass some pretty historic and revolutionary policies, including universal pre-K, smaller class size amendments, no smoking in public places, a living wage. We restored voting rights to formerly incarcerated people, a lot of good things. And say what you will about the legislature messing with some of these, because that does happen. But look, this is a place where this is the last shot, right? To protect access, to restore access to vital reproductive health care in Florida, but also the South. So it has to happen. And so we have Amendment 4 that will be on the ballot in November. We collected over 1.5 million signatures to get this on the ballot, and people will have an opportunity. And it doesn't even, what it does is it doesn't even take away reasonable regulations, because we believe that those should be in place, right? But it says to the government of Florida, that you may not restrict or delay or make it harder for people to access abortion care before viability, and then after viability, unless it endangers the health of the patient as determined by their healthcare provider and not their elected representative, which is really important. So this amendment is about stopping government interference in our personal private decisions. And so, we're just trying to get the word out now. I mean, it's a big lift. The Florida legislature also made it harder to amend the Constitution because people did, take policies into their own hands. So we have to pass it by 60%. But we're seeing this play out in real time with other efforts. You didn't have people being harmed in the moment. They were, but not as present as this issue, as salient as this issue, and top of the mind of the voters. And people will say to us, the campaign, oh, isn't this partisan? Aren't you going to, increase Democrats or whatever? But, Dr. Tian knows this, and you know this, Michelle, that our patients don't come in to Planned Parenthood as Democrats or Republicans at all. And so I think people see through that. And then I am very confident that we're going to get over 60% of the vote because people do not want government interfering in their bodily autonomy.
Yep.
We've already seen some of the recent polling on this, that more than 70% of Floridians do not want government interfering in their personal decisions when it comes to abortion. We're seeing that across the board. And I can only imagine, with a 6-week ban, the support for this amendment is going to be exacerbated because it's like everything else in life. If you don't know much about it, you don't know it until it affects you or affects someone directly impacted near you. So when that happens, it kind of hits home, and then you learn more. And sadly, that's going to be the impact of this law because 6 weeks, you don't even have enough time to learn that you're pregnant. Yeah. So I thank you both so much for being a part of this podcast. For everyone on the podcast, if you want to get more of our Planned Parenthood of Southeast and North Florida content, be sure to follow us on our social channels. Go to our website, ppscnfl.org. We'll have all the latest updates on the restrictions and how this is impacting patients. And we hope that you continue to listen to our podcast. Have a great day, everyone.